Welcome to the program entitled MRI and Patient Safety, Preventing RF-Induced Burns. I hope that by the end of my presentation, you will gain the knowledge and insight to prevent burns associated with radio frequency fields in the MRI setting. During magnetic resonance imaging, radio frequency fields are produced by driving electrical currents through an RF transmit coil, which is a coil located either within the inner walls of the scanner or as a freestanding device that is connected by a cable to the MR system. In this latter case, the RF coil is placed around the patient's anatomic area of interest. The currents that flow through the patient's tissues are converted to thermal energy as they encounter resistance. This phenomenon is referred to as ohmic or resistive heating. Tissue heating that occurs during MRI is primarily caused by magnetic induction, as the RF fields generate eddy currents in conductive tissues. While the electric fields also play a role in MRI, their contribution to tissue heating is trivial compared to the magnetic field. Because of the thermogenic nature of radio frequency fields, excessive heating and/or burns are the primary safety concerns. RF-induced burns are especially a concern when conductive materials such as metallic implants are in or on the patient. The anatomical area that is subjected to RF energy during MRI is dependent on the type of transmit RF coil that is utilized for imaging. Using the transmit RF body coil that is integrated into the MR system's bore results in the largest tissue area that is exposed to RF energy. By comparison, a body part specific transmit-receive RF coil, such as the transmit-receive head or transmit-receive knee coils, substantially decreases the exposed area and thus minimizes the risk of tissue heating. Because RF energy is predominantly confined to the anatomical area contained within the transmit coil, it is important to know if your RF coils are transmit-receive or receive-only coils, because of the safety implications, namely excessive heating and potential burns when scanning patients with metallic or conductive implants and devices. To date, first, second, third, and even fourth degree burns with tissue loss have occurred in patients due to magnetic resonance imaging. Three main factors are responsible for RF-induced burns. First, the near field or proximity effect. In this instance, the burn occurs due to direct contact between the patient's skin and the transmit radio frequency coil. The body transmit RF coil of the scanner is usually responsible for this type of burn, which tends to occur in obese patients and/or individuals with issues related to their cutaneous circulation. The best way to prevent a near-field effect burn is to increase the distance between the transmit RF coil and the patient's skin via an air gap or by adding positioning pads to prevent contact with the RF coil. The second factor responsible for RF-induced burns is the presence of conductive materials such as metallic items that may be external and/or internal to the patient's tissues. Conductive objects that may cause burns include ECG electrodes and leads, faulty RF coils, external fixation devices, and active medical implants that have leads, such as deep brain stimulation systems. To prevent burns related to conductive materials, remove all unneeded conductive items from the bore of the scanner or from the surface of the patient prior to the MRI exam, and prevent direct contact of such objects with the patient's tissues. For medical implants, burns are prevented by carefully following the MRI labeling with particular attention to the proper selection of the transmit RF coil and whole body average specific absorption rate, or the B1 plus root mean square values. The final factor responsible for RF-induced burns is the formation of conductive tissue loops that tend to occur at skin-to-skin contact points or in patients with unusual anatomical features. These burns commonly appear as focal tissue injuries. Conductive loop burns, which rarely occur, are prevented by avoiding areas of skin-to-skin contact, especially in the patient's extremities, by careful positioning and by ensuring that padding is used appropriately. Special attention should be given to padding obese patients that have skin folds in abdominal or other areas. Now, let's look at several examples of RF-induced burns. These two examples of severe near-field effect-related burns caused by transmit RF body coils occurred in obese patients. Notably, these patients did not have padding applied prior to their MRI exams. Be aware that near-field or proximity effect burns can occur in patients even when scanners are operating within recommended whole-body average SAR levels. As I indicated earlier, to prevent near-field effect burns, use positioning pads between the patient's tissue and the transmit RF coil, or increase the distance between the RF coil and the patient's tissue. Positioning pads should be a minimum of 1 centimeter thick. Notably, proper patient positioning and appropriate padding are essential for preventing burns in patients undergoing MRI. These burns were caused by the presence of conductive materials that were in direct contact with patients during magnetic resonance imaging. These cases involved external items including an ECG electrode, a faulty RF coil cable, a cell phone, thermal blanket, traction tongs, and an MR unsafe pulse oximeter. To minimize the risk of RF-induced burns from conductive materials during MRI exams, special precautions must be taken during patient preparation. Unconnected or unused ECG electrodes and leads have been responsible for many conductive material-related burns in the MRI setting. Therefore, patients presenting for magnetic resonance imaging that were monitored by electrocardiographic equipment should be searched to ensure that they do not have unconnected ECG electrodes and leads. These items must always be removed prior to MRI. Patients and research subjects should be dressed in pocketless gowns or scrubs for MRI exams because clothing may contain metallic fibers or conductive materials that can result in RF-induced burn injuries. Additionally, pocketless gowns or scrubs help prevent individuals from inadvertently carrying ferromagnetic objects into the MR system room. Here's an example of a burn caused by invisible silver-embedded microfibers in the fabric of an undershirt, illustrating the importance of having patients change into safe, facility-provided garments. Here's another example of an injury associated with the patient's clothing. In this case, a second-degree burn was caused by allowing the patient to wear jogging pants while undergoing a 3 Tesla MRI exam of his thighs. Note the susceptibility artifacts caused by the local magnetic field inhomogeneities created by the shiny material of the pants. Here's a report of 2 burn cases related to copper-dyed piping or trim in the hospital gowns. Susceptibility artifacts are seen in the abdominal images that correspond to locations of the copper-dyed trim on the gown. As such, it is important that patients be dressed in MR-safe gowns or scrubs, meaning that they should contain no conductive materials. Failure to follow the MR conditions for an intra-arterial pressure monitoring transducer can lead to RF-induced burns as shown in this example. The instructions for use, or IFU, for this pressure transducer stated that it is not allowed in the bore of the scanner and subjected to the transmitted RF from the body coil. This patient sustained a serious burn while undergoing an MRI exam of the lumbar spine because the pressure transducer was in direct contact with his arm. Note the evidence of excessive heating that resulted in a loss of insulation on the transducer's cable. This case involved a 14-month-old child that had a full-thickness burn following the use of a pulse oximeter that was not designed to be used with magnetic resonance imaging. This extremely unfortunate injury could have been prevented by using an MR conditional fiber optic pulse oximeter instead of one that was MR unsafe. 2 RF-induced conductive material-related burns have occurred in patients with deep brain stimulation systems in association with MRI. These patients had MRI exams performed using conditions that deviated from the MR conditional labeling for this neuromodulation device. In both cases, the patients were scanned at 1 Tesla 42 MHz instead of 1.5 Tesla 64 MHz, and there were other aspects of the labeling that were not adhered to. This is an axial plane MR image of the brain obtained in one of the patients that shows the injury in relation to the deep brain stimulation electrode. This substantial lesion resulted in a permanent neurological deficit in the patient. These cases emphasize the importance of following the MR conditional labeling when scanning patients with active implants. The formation of conductive tissue loops has been responsible for burns during MRI. The so-called kissing burn refers to a type of burn that occurs when two body parts touch during the scan, creating a closed-loop conduction circuit. This example of a kissing burn occurred in this patient as he underwent an MRI exam of the abdomen. His lower thumb was in contact with his outer thigh. Note the blister on the lower thumb and the focal lesion on the patient's thigh. To prevent these burns, use proper patient positioning and add padding to avoid body parts from creating tissue loops. A study by Knopp et al. Reported a rare case of severe burns that affected the patient's lower extremities during magnetic resonance imaging. The authors indicated that the second and third degree burns were caused by a closed conducting loop that inadvertently formed, leading to a focal increase in temperature at the junction of the patient's medial calves. This patient had unusual anatomy due to a previous resection of a liposarcoma and radiation therapy. Here's another example of a conductive tissue loop burn in which a patient underwent an MRI exam of the pelvis of 1.5 Tesla. According to the case report, the patient experienced pain and burning during MRI, but did not complain to the MRI technologist. Second-degree burns occurred in the patient's upper thigh contact points. This case and the prior ones highlight the importance of appropriate patient positioning and padding to prevent skin-to-skin contact points. Because padding is such an essential part of preventing near-field effect and conductive tissue loop burns, I will present an example of how to pad a patient in the supine position with his arms along his sides. First, ensure that padding is placed on the sides of the patient to prevent direct contact with the bore of the MR system. That means there should be no contact between the patient's tissue and the transmit RF body coil. Next, place padding between the patient's arms and hands to avoid tissue contact points. Finally, padding should be placed in between the patient's upper thighs, and if needed, additional padding may be placed between the patient's ankles or feet. Be mindful of other tissue contact points, such as skin folds in obese patients, and add pads to those places as well. Recently, Pearl Technology has provided a new solution to prevent contact between the patient and the transmit RF body coil. The angel pad shown here fits on top of the MR system's patient table. As the patient enters the scanner, the sides or wings glide easily and fold up, preventing contact between the patient's tissues and the bore of the scanner. The innovative design of the angel pad ensures that there is no slippage of the pads as the patient enters the MR system, which may occur when standard pads are used. The prevention of excessive heating and burns requires an understanding of the safety procedures for patient management, especially with respect to the proper use of transmit RF coils, monitoring equipment, as well as when electrically conductive implants and devices are present in patients. Guidelines to prevent excessive heating and burns may be found in the Safety Topics section of my website, mrisafety.com. Thank you for your time and attention to the important matter of preventing RF-induced burns in the MRI environment.